Hey everybody, what's up? This is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance based in New York. And we're back today with another episode of the Audiologist at Home episodes, which we're at home. You guys are at home because of what's going on with coronavirus. So we decided to answer some questions that pertain to hearing and balance disorders and what we see in our practice on a day-to-day basis and what patients might ask of us. Today, I have Dr. Naim with me again. What's up, Dr. Naim?
Hello, how are you doing?
I'm doing well. How are you today?
Good.
So you had an internet outage in your apartment, which, especially because we're all quarantined, would be absolute disaster if you had no internet, no TV, no phone.
I know, but thankfully just moved some wires around, made it work. So
that's awesome. Well, I'm glad that you're back up and running. So that allows us to have a conversation right now. So the question is a pretty broad question, but I know that you can answer it. And this is something that kind of serves as the foundation of our practice in many ways. So the question is, if someone suspects that they might have a hearing loss, what types of testing would you do to determine what's going on with them?
So that's a really good question. The first and most important thing I would say is before we even start the testing, it's really important just to get a case history from the patient. Just ask them questions about, number one, what brings them in, any medical history that might be going on, if they had a cold recently, what exactly with each ear is going on, if there's any fullness, pressure, ringing in the ears, dizziness. Once we have kind of a broad understanding of what brings them in, the next thing that we would do is actually otoscopy. We take a look in the ears using an otoscope, just to make sure there's no blockages, wax buildup, that the eardrum looks healthy. Then we actually test the movement of the eardrum with something called tympanometry. So we're using pressure to see how the eardrum is moving, if there's any fluid or congestion built up behind the eardrum. And that just gives us the first piece of the puzzle when it comes to someone's hearing. At the same time, when we're doing tympanometry, we're actually testing something called acoustic reflexes. We're looking for acoustic reflex thresholds. And that's actually a reflex that we have from a muscle in the middle ear space to loud sounds. So you can get both ipsilateral, meaning the same ear, or contralateral reflexes. It's super quick, super easy. There's no pain involved. But again, it is loud, so some people might not enjoy it for the first couple of seconds that it's happening, but it's super quick.
And we might not even do that on every patient necessarily, right?
Exactly, specifically for someone who, let's say, has tinnitus and it's super bothersome, then in that case, we would skip it altogether. The next thing that we do is we want to look at the function or the health of the hair cells in the inner ear. So we have tiny little hair cells that respond to sound, and we can actually measure the health of those hair cells using DPOE, so distortion product otoacoustic emissions. So we send sounds to the hair cells, and the easiest way to kind of explain it is that healthy hair cells will send a sound back. And we're actually measuring that. So
the ear actually makes a sound if it's healthy, and that's something we can measure.
Exactly.
Gotcha.
So sometimes if there's a history of noise exposure, some certain medications, sometimes if there's a cancer treatment, they can actually damage those hair cells, and we can see how much of those hair cells are damaged and in which frequencies. So we're looking we have the ability in our office to look at the frequency that there is damage. Now the next part, and this gives us an even better picture of what the hearing looks like, is we're doing air conduction testing, which is when we put headphones on our ears and we're getting frequency specific thresholds. So those are the lowest level that you can detect sound across low, mid, and high frequencies. Now again, this is all part of the basic hearing test, but it's also really important to get bone conduction thresholds, especially if there is if there is a hearing loss. Mm-hmm. We want to get bone conduction testing also, so we know the type of hearing loss that we have, whether it's coming from the auditory nerve or it's something where there's if it's fluid, and we have a conductive hearing loss, which says that there's something in the outer or middle ear blocking the sound from going all the way through. So I would say that's probably a standard hearing test. Depending on how everything goes, it shouldn't take more than 15 minutes. Now, there are objective parts where the patient doesn't have to respond, for example, the DPOAEs or the TIMPs, but the subjective part is where they have to raise their hands in response to get those frequency-specific thresholds.
Sure. So it sounds like a very comprehensive assessment in a very short period of time,
Right.
looking at every aspect of the hearing mechanism so we can determine if there's a problem. And if there is a problem, through all of these different tests and putting the puzzle together, we can determine where the issue might actually be occurring, correct?
Absolutely, yeah. And we also have other capabilities for other like specific situations. So for example, sometimes we'll do ultra high frequencies just to get a better picture. For example, if we want to use that for counseling when it comes to tinnitus. But again, all these things just give us a better understanding of what someone's hearing looks like. And then we can use that to counsel them further, again, based off of what they're experiencing. And whether that's discussing hearing aids or tinnitus management strategies, it's all little pieces of the puzzle.
That's awesome. Well, I appreciate you sharing that with us. There's so much more that we can dive into when it goes into testing, and there's so much more that we do as clinicians in the practice, but that's always kind of the foundational test that we do for every single patient. So I appreciate you clarifying that and answering that question for all of us. And if you guys have any other questions out there that you'd like us to answer, you can send your questions to info@NYHDoctors.com. That's info@NYHDoctors.com. Dr. Naim, I appreciate your insights again today. It was good to see you.
Very good to see you too. Stay safe.
Stay safe as well, and we will talk soon. Take care, everybody.
Bye.